Welcome tonight. Okay, welcome. My name is Jess Posner, and I am the Virtual Programs and Membership Services Director for the YMCA of Central New York. It is my pleasure to welcome you tonight to the third event in our month-long speaker series focusing on mental health awareness. Tonight's guests include Talia Shenandoah and Ashley Davis from the Q Center at ACR Health in Syracuse, New York. They'll be presenting on stress management and healthy coping skills. I don't know if anyone else has had a week. I mean, actually, almost everyone I know has had a really stressful week. So I am really looking forward to learning from Talia and Ashley tonight. I also just wanted to mention that most of Talia and Ashley's work focuses on youth and teens. So their presentation will be super useful for those of us with teens and youth in our lives, or for those of us that maybe sometimes still feel like teens, especially when we're stressed out. So I don't know if I'm speaking to anyone else in the room, but I'm definitely speaking to myself there. So for a few announcements tonight, before I introduce our speakers, I wanted to say that even though the month of May is almost over, we do have one more event for our mental health series next Wednesday, June 2nd at 5 p.m. We had to reschedule that. That is with Chris Kosikowski from Vera House, and Chris is a wonderful presenter, and his presentation promises to be thought-provoking and helpful in terms of thinking about the relationship between all different forms of violence and our mental health. The Q Center, where Talia and Ashley are joining us from tonight, we'll also be offering a workshop on June 24th from 4:30 to 6:30 p.m. through the Y on occasion of Pride Month, which is free and open to all. The workshop is called Gender and Sexuality, Creating Affirming Environments for All, and it covers updated terminology in regard to sex, orientation, identity, and expression, a look at health disparities affecting the queer community, promising practices to create affirming environments for transgender and gender expansive individuals, and ways to be a better ally. This will also be virtual on Zoom, so please be in touch with me if you're interested, and you can always reach me at virtual@ymcacny.org. We'll also be promoting it when we push out all our Pride events, which we're very excited about, many of which will be virtual, and those will go public on June 1st and happen throughout the month. A little housekeeping. You'll notice that you are automatically muted when you entered. This is to help maintain a pleasant experience for everybody. So please keep your sound off, but do feel free to use the chat. I will be monitoring the chat box to collect questions and comments for the Q&A session following the presentation. I will be spotlighting our speakers tonight, which will highlight them on your screen when you have the presenter view selected. To turn this on, please click in the upper right-hand corner of the Zoom window and select presenter view. We are also recording this session so that we can post it on our Virtual Y website and our YouTube. And any publicly shared version of this video will only include the feed from myself and from our presenters tonight. Speaking of speakers, it is my pleasure to spotlight and also introduce our speakers. So let me go ahead and get them spotlighted here. Let's see, where'd Ashley go? There they are. Okay. Okay, so it is my pleasure to introduce Talia Shenandoah and Ashley Davis. Talia Shenandoah is a youth development specialist and has worked at ACR Health since July of 2016. She began work with LGBTQ youth at the Q Center at ACR Health in April of 2017. She has over 8 years of experience in the human services field with a special focus on HIV and STI prevention and education. Her passion lies in helping others overcome barriers to healthy living through a trauma-informed lens. Ashley Davis is the CNY Q Center Program Coordinator and has worked with ACR Health since March of 2020. While based in Central New York, Ashley also assists with operations at both the Mohawk Valley and Northern New York Q Centers. Additionally, outside of the human services field, Ashley is the K-6 Sunday School Coordinator at Immanuel United Methodist Church in Camillus. She enjoys working with the youth and enjoying nature. So without further ado, it's my pleasure to turn the virtual stage over to the two of you, and you can go ahead and take it from here.
Thank you, Jess, and good evening, everyone. I'm Talia Shenandoah. I am the Youth Development Specialist at the Q Center at ACR Health. My pronouns are she and her.
I am Ashley Davis. I am the Program Coordinator at the Q Center, and my pronouns are also she, her, and hers.
All right, so I'm going to go ahead and share my screen now so you can all see my presentation. Okay, there we go. All right, so to begin, Jess already kind of highlighted the fact that, that we work with teens and young adults. So this presentation that you're going to be hearing tonight is going to be hopefully in a pretty comprehensive format. I am not a medical doctor, nor am I a specialist in neuroscience, but this is work that is very important for young people to learn and talk about. And so this is kind of like some insight into the work that we do at the Q Center with our youth. So the beginning of this presentation will be focusing on stress management and coping skills. And then we're going to look briefly at the impact of, stress on the LGBTQ community. And then Ashley is going to give an overview of services and programs that are available at the Q Center. So if you have questions, you can go ahead and pop them into the chat. We'll take a look at them at the end. And if for whatever reason we're not able to answer them in the time frame, we'll definitely can exchange information and follow up with you after. So let's get started. Okay, so stress, the word stress, this is a noun. So a couple of different definitions. Stress means a state of mental tension and worry caused by problems in your life or work or etc. Stress is something that causes strong feelings of worry or anxiety. And stress is also your body's way of responding to any kind of demand or threat. The effects of stress. So the way that stress works is, it happens with your brain and your nervous system. And when you're feeling some type of stress or some type of threat or any type of stressor is affecting you, it activates your central nervous system. And what happens is your central nervous system releases hormones that get your body ready for action, right? So the purpose of, stress hormones are really to kind of get you, situated to take the next step or make action on whatever is, facing you that you may need to keep yourself safe. So ideally, that's how the body, is supposed to respond to stress. So your fight or flight response is your body's way of protecting you. So we're going to get into fight or flight or actually freeze as well as we go along. But I just want to take this moment to acknowledge that repeat experiences of fight or flight can be very harmful, especially over the long term. And this is where we can start to see, long-term effects and damage to our mind and body from prolonged stress. Chronic stress disrupts nearly every system in your body. It can result in decreased immune system. You can raise your blood pressure, can upset your digestive or your reproductive system, increase your risk of heart attack or stroke. People will experience sometimes accelerated aging process, or, prolonged stress could lead to mental and physical health problems. So we're talking long periods of time, repeated instances of being stressful state and producing stress hormones, your body responding to those. So taking a look at fight or flight, you might be familiar with this. Fight or flight is your response. Are you going to stand and fight it out and duke it out? Or are you going to flight? Are you going to run? So I like to kind of think of this in like caveman terms, right? Because that was back before we knew anything about the world and it was a much simpler time. So this is really like a good example of, fight or flight. But now we have freeze as well. So some folks, also have difficulty reacting when they're under stress and may not know how to respond. And that's where, the freeze might come in, where they're not able to maybe say anything or do anything of physical action. So I apologize that the graphic on the right is a little bit fuzzy. I tried to tweak it a little bit so you could see it a little better, but this gives you, kind of an idea of what's happening in your body when you are in that fight or flight state. So on the left-hand side, looking at your noticeable effects, things that are happening to your body, your pupils dilate, your mouth goes dry, you might feel tension in your muscles, heart's pumping faster, you might be sweating, breathing fast, your body's really getting ready for whatever it is, whether it's that fight or flight. So all of these things happen to prepare you. So additional effects, the things that are going on in your body that you may not see right away are, your brain's getting ready and your neurons are firing, your adrenaline is rising, blood pressure goes up, your sugar goes up. The sugar is there to provide your muscles with the energy needed to, take your next action. So these are the kind of things that are happening, and your digestion slows down, sphincters close, and cortisol is released. So cortisol is kind of the kicker. You might have heard that word before. And that is a hormone that's released that depresses your immune system, but you might have heard that too, and how long-term stress can lead to, different issues. Like, for example, when people who are in states of stress might experience weight gain, for example, and you might collect, you might have adipose tissue or fat collecting in your stomach, for example, or around your organs. Cortisol is a big factor in how that can happen. So stress hormones tend to, affect certain areas of your body if they're happening over long periods of time. So cortisol can really be a kicker. So some health problems that are caused or exacerbated by stress include depression, anxiety, weight problems, autoimmune disorders, sometimes skin conditions, especially if you already kind of have some autoimmune issues like eczema or psoriasis. Things like that are really triggered by stress. So you might be experiencing more of these symptoms or more of the side effects of these conditions. You can experience reproductive issues, so for those who menstruate, you might have, differences in your cycle as a result of prolonged stress. Sometimes people feel pain. It could be general, it can present itself pretty much anywhere in your body. Heart disease, definitely effect of stress, digestive problems, sleep problems, and then cognitive memory problems. So you can kind of see there's a lot of different things, and this is just a small list in terms of what can actually happen by prolonged stress. But this is kind of the more common side effects that you see when people are operating in under stress. So causes of stress, looking at stressors. Stressors are situations and pressures that cause stress. This can be anything that places high demand on you, and it could be something that's negative, or it could be positive. So we tend to think of stress as always being a negative, and sometimes there could be a positive effect as well. So it's important to consider that stress doesn't always necessarily need to mean bad. Some folks are able to still be accomplished and still do a lot of things under stress in a healthy way or under a healthy amount. So I just wanted to reiterate, while we're focusing on a lot of the things that stress can cause for you, it doesn't necessarily always have to be negative. Stress is also caused by internal or external factors. So if we look at the right here, the right side, looking at external factors, so things that are going on around you or in your life, could include major life changes or work, school, things that are happening in relationships, could be very, influenced by your finances or things that are happening with children or family, definitely busy schedules. And so something that's not included here, which I actually think that I may need to consider adding to, is natural disasters or human disasters or those types of traumas. So, considering we've all been under, increased stress for the last, 15, 16 months due to COVID. There's a lot of things that are happening around you that you may not necessarily be able to change or control, that are affecting how you're feeling and then how you're reacting or responding to other things. So even though that's not on there, I wanted to acknowledge that. And then some internal factors or internal stressors could be chronic worry or pessimism, rigid thinking, lack of flexibility, negative self-talk, perfectionism, unrealistic expectations, all or nothing attitude. So this is just kind of a look, just a little peek into some of the things that folks might be feeling internally that are causing additional stress. So, sometimes it could be that we're just really hard on ourselves. And, if you wanted to look further into trauma response, you might find a lot of information around anxiety and stress. They go hand in hand, and a lot of that can really stem from trauma that has not been dealt with or healed from. So, this is our body's way of kind of reacting to things. And this is what we know how to do. And sometimes you can find yourself in that cycle that's really hard to break. So some of the internal things that you might see or feel. Symptoms of stress. So now we talked briefly about how stress can present itself in fight or flight, or what happens in your body in the state of fight or flight. But this is looking at how stress can affect your body pretty much at any time. So looking at your cognitive symptoms, you might experience memory loss, inability to concentrate, poor judgment, negative outlook, anxiety, racing thoughts, constant worrying. So, stress really does kind of give you that brain cloud, right? So that feeling of not being able to be connected. And emotionally, this might look like depression, unhappiness, anxiety. You might find yourself, really sensitive and, moody, or able to kind of, get upset easily or snap easily. You may be experiencing loneliness or isolation or other mental or emotional problems. Stress over prolonged periods of time can, it could very much be like a downward spiral. In terms of physical symptoms, aches and pains, diarrhea or constipation, sometimes nausea, dizziness, maybe chest pain, rapid heartbeat, loss of sex drive, frequent colds or flu. So that's a big one is, we're going to touch on this a little bit more, but the immune system. And that's something that I think that a lot of folks don't really think about or necessarily consider, is that, being stressed out can really, really harm your immune system and your body's ability to create new cells that are able to, work for you. So like, if you remember kind of back into, science, and we're learning about how cells make new cells and how all of that information is exchanged. And, we have all of these different parts of cells. We have receptors on the outside of our cells that are able to process the hormones that are being released in our body. So if we're, living in a really high state of stress all the time, what happens is your cells are created, like your new cells are created, lacking certain receptors. And so they don't even have the ability to process those feel-good hormones, even if they exist. So that's kind of thinking about what's happening on a biological level can help to understand, how important it is to acknowledge that when you can. So we're going to get into that a little bit more when we're talking about coping. But this is really, taking a look at how, how your immune system can be affected and how your cells are affected by stress. So behavioral symptoms: eating more or less, sleeping too much or too little, withdrawing from others, procrastinating or neglecting responsibilities, or nervous habits, and then especially using alcohol, drugs, or cigarettes to relax. So especially in this past year, I know I've seen a lot of discussion around folks that, maybe didn't do these things, that are in situations where they're either re-engaging or tempted to re-engage because of, the way that things are right now. It's a lot harder to reach resources. It's a lot harder to link with, mental health professionals. There was periods of time where, it was really hard to get in to see a doctor because of COVID. So things are starting to, kind of open up now and become a little bit more accessible. There's a lot of telehealth options for folks to still be able to engage with practitioners, from the comfort of their home. But, this is definitely something that we're seeing a lot of, prolonged stress and trauma over COVID, especially, and how that can affect your behavioral symptoms. Okay, so moving into the positive stuff now. So we want to look at increasing stress tolerance and ways that you can do that. So emotional awareness is huge. Being aware of how and what you're feeling physically and emotionally. And this is, it can be really challenging, especially if you have a really busy schedule or you're constantly on the go, but really taking time to check in with yourself and practice mindfulness, not only on how you're feeling, but especially like situations that you're walking into. You want to have awareness and recognize stress and be able to calm and soothe yourself. And the more that you do this, the more you're able to increase and rebuild your tolerance to stress. So looking at support network, build yourself a support system and quality relationships with people you can be comfortable talking to or sharing your feelings with. So, there's lots of different ways that you can do this. You can, you can look for friends that you can call on the phone or maybe text. You can look for online groups, maybe people that have similar interests, forums where you can go and talk about things that interest you. There are a lot of different support groups. And then, now in the virtual age where everybody is kind of still operating, on Zoom or Google Meets or whatnot, there's a lot of, opportunities to try different groups. And a lot of folks are planning to, or I've heard discussion anyway, that folks still want to keep that around because it's increased accessibility for people who may not be able to travel or, have transportation or whatnot. So looking into support networks, there's lots of different ways that you can do that. So physical activity is another big one. Regular exercise can enhance your mood and allow a mental break from stress. It's a great way to get out, that frustration that you're feeling. There's lots of different ways you can do that, whatever really works for you. Getting out and going for a walk, taking a class, maybe doing some cardio, going for a swim, lots of different ways that you can engage in physical activity. But it's really important to get yourself moving and to have some type of a way to release those feelings that you're feeling. So looking at diet, this is one that folks, kind of forget about sometimes. And, I myself am also very guilty of this. Being a very busy person, you find yourself, just trying to stay on schedule, and maybe you're not necessarily eating things that are great for you because of lack of time or whatever the reason. And it's just really important to reiterate how important your diet is and what you're putting into your body, because that is really what's going to fuel you. And that's not news, right? We all know that. But in terms of how you're feeling, if you're feeling bad and then you're, eating like fast food or things that don't have a lot of nutrients, you're really not giving your body the ability to, kind of come back from those type of situations. There's no nutrients. Your mood is affected by what you're eating. Maybe that's going to also, roll into lack of sleep and that sort of thing. So focusing on, fruits, veggies, high quality protein, and healthy fats. These are all things that can help you cope better and then, eating processed food. And of course, water. That's, one of the biggest things is making sure that you stay hydrated and, looking into how much water you should be drinking, because it's different for everyone, right? It depends on what your body weight is, and there's all these different factors. So looking into how much water you should be drinking, and then, trying to monitor that or finding ways that can encourage you to want to do that, to want to drink water all the time. So maybe it's adding fruits or, adding even the, frozen, I like the little lemon packets, the dried lemon packets personally. But people like to put, cucumbers and fruits and all kinds of stuff in there. And it's good because there's nutrients in there, but it's also adding that little extra flavor tends to make people want to drink it more. So if you haven't, looked into alternatives to spicing up your water game, I definitely would recommend doing that so that you can get proper hydration. And then that will also help not only for stress, but for a lot of different things, especially your immune system. So sense of control, your ability to persevere, and confidence, feeling in control builds tolerance to stress. So increasing your sense of control. So, we touched upon emotional awareness. So, really just kind of gauging how you react to certain situations, or like if you know that you're going to be entering a situation that's going to be stressful, giving yourself a little pep talk, kind of giving yourself a little game plan, and, kind of just supporting yourself and knowing that you have a sense of control can really help in decreasing stress to stressful situations. Attitude and outlook. So having a positive attitude versus a negative one. Sometimes that's hard, sometimes it's not easy to be positive all the time. But it's really important to just try to find something to be happy about, or something to be proud about, or something to congratulate yourself for. So there's lots of different ways that you can help to improve your attitude. I know like with our youth, a couple of things that we've recommended is like, you know, at the end of the night before you go to bed, write down 3 things that you had go great for you, or think 3 things that you're proud of. Or maybe there's another one we did where we had like you could take like a bag or a basket or a jar and just write yourself a bunch of compliments. Write things that you love about yourself, things that you want to celebrate, and then make them accessible. You can have that for when you're having a rough day and you need a little pick-me-up. You can just go and you can take one of those out and read it, or 2 or 3, however many you need. But just kind of having like that's part of your own support network, is doing that for yourself. So there's lots of different ways that you can look at increasing your outlook and having a positive attitude. Knowledge and preparation. So knowing more specifics of a stressful situation in which you can prepare may be helpful in coping with stress as well as stress reduction. So, you know, asking questions, and even if it's not to other people, it could be asking questions of yourself. You know, if you're going to, let's say, for example, like holiday time and being around lots of family and maybe not necessarily being on the same page with everyone is kind of a really common thing that a lot of folks struggle with. So, you know, when we work with our youth, we try to talk to them about, you know, creating a safe space for themselves, and, you know, having responses to things that might be said to them that might make them uncomfortable. So really, it's just kind of like having a safety plan for yourself. So the more that you can find out about the stressful situation that you might be walking into, the more you can kind of create a safety plan for yourself so that you are able to get through that and feel okay. So looking at some coping styles. So there's a few different coping styles that exist. I didn't go into great detail here. If this is something you're interested in, I would definitely encourage folks to look into each one of these a little bit more thoroughly. But there's problem-focused coping, which are practical ways to target or tackle the cause of stress to reduce or remove the stress. So this is really like problem solving, trying to get to the bottom of things, and you know, coming at it really from a practical approach. Then we have emotion-focused coping, which are techniques that involve changing your emotional reaction to stressors. Then we have active coping, which is trying to control pain or function despite stress. And then we have passive coping, which could be withdrawing and surrendering control over stress. So, you know, folks are kind of all over the board in terms of how we're handling things on a daily basis, but maybe just having knowledge about how each one of these work and what kind of techniques exist for these types of coping can really help you in your strategy on how you want to approach stressful situations. Looking at some healthy coping mechanisms. So we have exercise, physical activity. We touched on that briefly, but it releases endorphins, or your feel-good hormones. So, you know, do whatever feels good to you. It doesn't have to be very rigorous. It could just be a walk down the street. You might feel better just getting some fresh air. Connecting with others. Talk with family members, friends, or people you can trust about your feelings, and consider seeking out a mental health provider for professional support. So yeah, setting up your support systems, whoever they might be that you're comfortable talking to. Sometimes, you know, it's easy to talk to someone who doesn't know you very well, because it's easy for them to maybe offer their advice or their insight without having those, you know, knowing very personal things about you. So you know, finding a mental health provider is something that we help people do a lot as well. So I mean, I know I'm kind of jumping ahead, but we're going to get into local resources and national resources as well. So if that's something that you're interested in terms of finding a support network, if you don't feel like you have one, there are some numbers I'm going to be sharing. Improving relationships. So learning forgiveness and letting go of negative feelings, really important. So that can be really hard to do depending on the situation, you know, whatever you have experienced. But in terms of your own healing and being able to move on from, you know, situations that are hurting you, you know, learning how to forgive folks, even if, you know, you may not even necessarily think that they deserve it, but learning how to find a place where you can forgive them and move on from that is really going to help you in your healing. Hone your communication skills and consider the big picture. Healthy hobbies, positive self-talk, reading, writing in journals, coloring, and crafting. So anything that you love, really, anything that you love that makes you feel good, that isn't hurting anybody, is a healthy hobby. So whatever you want to do to make yourself feel good, try to schedule time for yourself to be able to do that, at least on a semi-regular, if not regular basis. And ultimately, rest. Adequate rest helps to restore the body and mind, and aiming for 6 to 8 hours of sleep per night is really important. What happens when we don't get enough sleep is we become more irritable. We may lash out at folks. We may not be able to, focus, and this can kind of throw off everything in our day, right? It's just can be a vicious cycle. So getting adequate rest and exercise and diet, all of these things not only help you and your body and your well-being and your healing and your immune system, but also dealing with stress and lowering the likelihood that you are going to be overwhelmed with stress. So reconfigure. What we want to do is set intentions to find new ways to approach problems, reframe the problem in a way that allows you to recognize similarities you were able to overcome before. So that's, being really mindful and just kind of exploring the situations, like really picking apart what makes you feel stressed and trying to figure out, well, how can I stop this from happening? Reduce your load. Sometimes you have to just accept that you can't do everything. Keep track of your schedule and how you feel each day, and work out your optimal level of activity. You should be busy, entertained, and challenged without feeling overwhelmed, right? So we all got a taste of this when the world kind of stopped for a moment and we were used to being so busy and then we couldn't do so much. That was really hard for a lot of people to deal with. Hopefully what you are maybe coming out of this with is at least, some insight into what matters most to you, or what makes you feel good, or what you want more of in your life. And if you're not there yet, that might be something that would be a healthy goal, is to start thinking about what those things look like for you. Relax. Practice mindfulness through yoga, meditation, breathing techniques, or simply taking some time for yourself, doing something that makes you feel good, right? So all of this is just kind of a look at things that go on in your body, things that could go on in your body, things that do, and how to stop it. Really, you got to just do what makes you feel good. And whatever it is that makes you happy, add more of that in your life. Ultimately, it's no secret in terms of how to manage stress and how to cope with it. It's really just finding a way to make yourself feel good and focus on what's important to you. All right, so now we're going to take a closer look at some of the impacts of stress on the LGBTQ community. So this image here is from the Trevor Project, the effects of mental health in the LGBTQ community. Up to 7% of Americans experience a mood disorder each year. Suicide is the second leading cause of death in LGBTQ individuals aged 10 to 24. LGBT people are 3 times more likely to experience a mental health condition. LGBT youth with high rejecting families are 8.4 times more likely to act on self-harming behavior, including but not limited to suicide. Up to 30% of LGBT individuals abuse substances, as compared to 9% of general population. And each encounter with LGBT victimization due to harassment or abuse increases the likelihood of self-harming behavior by an average 2.5 times. So, this was, let's see, this here is a couple of years old, but this coming from the Trevor Project is a great resource that comes up a little later in terms of all kinds of resources for learning, as well as they do have a helpline too. So mental health impact, some more things to consider is minority stress, stigmatization, discrimination or dehumanization, healthcare disparities, high rates of mental illness in the LGBTQ community, and also LGBTQ plus community members are more likely to develop anxiety disorders and generally will experience an overall lack of support. So this is, these can be broken down further, but this is kind of giving you a look at some of the major issues or impact that we see on the LGBTQ community from, prolonged stress or stressful situations. Looking briefly at minority stress and gender identity, trans folks experience increased prejudice in the form of extremely high rates of physical abuse, sexual assault, employment discrimination, and harassment. Also, high rates of concealment of identity among transgender people in an effort to avoid conflict, harassment, and intimidation. Minority stress over time can be corrosive to overall health, as well as the impact of fear or experience of rejection. So, we say trans folks here, but I also just want to highlight gender expansive. So this is, any individual who doesn't identify under the binary as necessarily, society's idea of what is male or what is female, really experience a lot of these types of discriminations and discomfort in a lot of the situations that they're going into. So just kind of thinking about what types of, if you are not part of the LGBTQ community and what stress feels like or stressful situations feel like, add to that, going into a situation and not, knowing people, or maybe having to gauge what kind of information you want to share with them and how comfortable that's going to be and how they're going to treat you, and how stressful that can be pretty much going into, any situation that's brand new to you, or maybe even not new. So just kind of looking at, the increase in stress on gender expansive folks. So before we go into resources, I want to take a look at the Trevor Project National Survey on LGBTQ Youth Mental Health. So this is actually all data that was, compiled over the last year, and looking at LGBTQ youth specifically. So 40% of LGBTQ respondents seriously considered attempting suicide in the past 12 months, more than half transgender and non-binary youth having seriously considered suicide. 68% of youth reported symptoms of generalized anxiety in the past 2 weeks, including more than 3 to 4 transgender and non-binary youth. 48% of LGBTQ youth reported engaging in self-harm in the past 12 months, including over 60% of trans and non-binary youth. 46% of LGBT youth reported that they wanted psychological or emotional counseling from a mental health professional, but were unable to receive it in the past 12 months. And I'm going to expand upon that and just share that, a lot of what we see at the Q Center in terms of referrals or case management is young people who are looking for an affirming provider that can help them with mental health support. So that is something that the Q Center can do. And we do have a trans resource guide that features a listing of, practitioners as well as other service providers. And, you don't have to be transgender or, identify as anything specifically in order to take a look at this guide. The people who are listed in there are equipped to assist any LGBTQ plus identified person and beyond, but especially have been known in the community to be affirming. 10% of youth reported undergoing conversion therapy, with 78% reporting it occurred when they were under the age of 18. 29% of LGBTQ youth have experienced homelessness, been kicked out, or run away. 1 in 3 LGBTQ youth reported that they had been physically threatened or harmed in their lifetime due to their LGBTQ identity. 61% of transgender and non-binary youth reported being prevented or discouraged from using a bathroom that corresponds with their gender identity. And 86% of LGBT youth said that recent politics have negatively impacted their well-being. And transgender and non-binary youth who have reported having pronouns respected by all or most people in their lives attempted suicide at half the rate of those who did not have their pronouns respected. So that is a big, big, big one. And that's something that I'm not going to get too much into today, because you are going to have an opportunity next month to attend the Q Center's workshop. But, really moving away from making assumptions. It's 2021. We want to move away from, assuming that someone identifies any type of way or is into any specific thing based on what you see with your eyes. You can never be sure. The only way that you can know a person is to have a conversation with them and to get to know them. So assuming someone's gender identity, assuming someone's pronouns. These are things that we want to encourage folks to move away from. And a way that you can do that and try to find out in a healthy way what a person uses as pronouns or how they identify is to share their pronouns or share your pronouns. Like in the beginning, I said, my name is Talia. I use she, her. That would give you the opportunity to share yours with me. Or, if you don't know how a person identifies, maybe practice using gender neutral pronouns like they, them, theirs. And folks get caught up on that. They think that that's, it's grammatically incorrect, but the English language does allow us the opportunity to use they, them, theirs in a singular fashion. So just practice doing that. And then that way you will really limit the opportunity to accidentally misgender someone. So getting into the practice of that is encouraged, but more on that later. So looking at some national resources, we have SAMHSA, so Substance Abuse and Mental Health Services Administration. They have a mental health and a substance abuse helpline. And they also have natural or human-made disaster helpline. And I think that one, that's particularly important, especially considering we're still in a pandemic. So if folks are in need of support, these are some numbers where you can call and, talk to folks about how you're feeling. Then there is the crisis text line. So maybe you're not necessarily comfortable talking to folks on the phone and you would rather text. There's 24/7 support at your fingertips, and you can connect with a crisis counselor by texting home to 741-741. Then additionally, crisis support services. This is the same number as the National Suicide Prevention Hotline. So free and confidential support for crisis, anxiety, panic, and or suicidal ideation at that 1-800 number. And crisis support services also has a text option. So there is, more than one option in terms of being able to text someone for support if you're not comfortable talking on the phone. And then the Trevor Project, if you're thinking of suicide and or feel alone and want someone to talk to, you can call the Trevor Lifeline. So these are some national resources. Looking at some local resources, we have Dial 211. You can, ask for the Health and Human Services referral line. That's basically what 211 is. So they have a website, https, 211cny.com. And then there's mental health. They have a specific, it's broken down into categories when you go there. So under the mental health section, they have hotlines, support group information, counseling, and specialized service referrals. So a lot of information in terms of what's happening in the Syracuse area and where you can seek additional services. Contact Community Services has a helpline. So any type of, suicidal ideation or, panic or need for immediate support. If it's an emergency, you'd want to dial 911, but if you are feeling like you might want to talk to someone else, you can call the contact helpline. Then there's Comprehensive Psychiatric Emergency Program, or CPEP. They have both a phone number and a crisis outreach if we're looking for immediate help or maybe inpatient treatment. And then there's the Syracuse University Couple and Family Therapy Center and Q Center at ACR Health. So now we're going to roll right into the next segment and talk a little bit about what we do at the Q Center. And I'm going to hand it over to Ashley.
Yes, hello. So we are the Q Center at ACR Health. We provide safe and supportive spaces for LGBT youth and young adults ages. We go as young as 5 and we go all the way up through to 29 for some of our services. We provide resources that cultivate pride and leadership skills within those youth and young adults, as well as working together to create a safer community as a whole for queer youth and young adults.
I'm just going to scoot back really quickly because I think I might have.
I think you did, yeah.
I jumped over where we are.
Yes.
Yes.
So we work in 9 counties in upstate New York. We work in Cayuga, Onondaga, Oswego, Oneida, Madison, Herkimer, Lewis, Jefferson, and St. Lawrence counties. We have 2 physical Q Center locations, one in Utica and one in Syracuse, and then we have satellite services in Watertown and Auburn as well. These are just some of our programs that we offer. We offer the Young Men's Project. It's an HIV/AIDS prevention and education for many young gay men or men attracted to other men. from ages 13 to 29. And they also offer free and confidential HIV and STI testing. They do rapid testing for HIV, hepatitis C, and syphilis offered on site with test results available within 10 to 20 minutes, depending on the type of test. And we also do urine screenings for gonorrhea and chlamydia, as well as give out referrals for treatment. We also have care management services. They are available for LGBTQ youth ages 13 through 29 who need assistance with things like housing, advocacy, medical care, mental health services, and other special needs. And then we also have our CAP program, our Comprehensive Adolescent Pregnancy Prevention Program. This is a targeted prevention program for youth ages 10 through 21. It's an evidence-based curriculum that's delivered in school and community settings. And it's sexual and reproductive health education and risk reduction skill building that is also gender inclusive and trans inclusive as well. We also have an LGBT youth rapid rehousing and case management program in Onondaga County that primarily serves homeless LGBT youth from ages 18 to 24. Youth are entered into the program from local shelters. We provide rental assistance for homeless youth for up to 2 years and also support self-sufficiency through basic life skill workshops. And the goal of this program is to assist young people in becoming independent and successful adults. And we also have supportive case management services for up to 30 months. We also have the Eddie's Future Greatness Fund. It's a $500 award to support and promote higher education. It's available to LGBTQ youth and allies ages 16 to 26, registered in an accredited post-secondary institution. 4 total annual awards provided in the spring. So there's 2 in the spring and 2 in the fall semesters. And we also do community outreach and education. So we do LGBTQ cultural competency trainings. We do technical assistance that provide school and school-based organizations, also healthcare facilities, community-based organizations, and a lot more other ones to promote affirming and supportive environments throughout upstate New York.
Quick note on the Eddie's Future Greatness Award, because it's not on this slide, but that application can be found on the ACR Health website, and the deadline to apply is March 16th and September 16th of every year. So if you have youth that are looking for additional funding for school, please visit the ACR Health website.
Yeah, so these are one of the trainings that we provide. We provide the Gender and Sexuality 101 trainings. It's all about creating affirming environments. It provides kind of an overview of all of the identities and the terminology that kind of goes along with sexuality and gender. And it also comes with tips and skills that work towards building inclusive and affirming environments. And we can tailor it to all of your different needs. So we have one that's more school-based. We have one that's more healthcare based, so we can cater it to your needs, and it's appropriate for anybody who works with literally anybody. So
yep, and in order to book that, there's information here. There's what we do at the Q Center is we will send you a presentation request form, and then you can send it back to us, and we will hook you up with some staff that will facilitate that for you. So if that's something that you're interested in, please connect with us.
We also have our family peer advocacy program. Our family peer advocate is Karen Fuller. She is like our Q Center rock star. She is our credentialed family peer advocate. She is able to meet with families of LGBTQ youth one-on-one to help assess what support the family needs. She helps educate and answer questions that they might have about how their child is identifying. And also provides links to appropriate providers, assists with name and gender marker changes, as well as providing advocacy support in schools. Karen also runs a support group for parents and families of transgender and gender expansive youth in all 3 regions that we work in, all 9 counties. They are currently all virtual. So there are 2 different, yes, what parents can expect at group with Karen. So all parents will meet with Karen before attending group. Kind of allows you to share your story and give her a little more information. And group structure and policies are gone over in that meeting as well. And so at every group, you'll introduce yourself, your child, what age, and where you are in the process. New parents have the floor first to share their questions and ask questions. And then we do updates and open discussions. So we occasionally have guest speakers come in and share information on topics that cover all aspects of parenting. And groups are every Wednesday. There are 2 different times. So there's one in the afternoon and then one for later. So it kind of works out if you might have like a work schedule that needs to be worked around. Karen's got you covered. Programming for the Q Center right now. We have weekly virtual social support groups for youth ages 13 to 24. The virtual support groups for parents of transgender and gender expansive youth. We have GSA, or Gender and Sexuality Alliance support for schools, care management for youth. And you can always contact us however you would like to get a referral. So what youth can expect in group with coming with us. So all youth will meet with the staff beforehand to complete some group paperwork, go over group rules and expectations, and we do it over Zoom. So there's no traveling involved. You just pop into the Zoom chat. Group is usually about an hour long. So we do a circle time and then a little bit of free chat and then an activity. So circle time, we usually do name, age, your pronouns, your gender identity, and your orientation. We do with low of the week. So for example, it's super hot in my apartment. We do a high of the week. I'm getting to do this in my apartment and my cats are cute. And then we do some sort of random fact. And the random fact changes from week to week. And our schedule, as it stands currently, is Tuesdays from 3:30 to 4:30 for young adults that are out of high school, so 18 to 25. And then Wednesdays, we have our Youth and Allies group from 4 to 5 p.m. And that's kids and people still in high school ages 13 to 18. And then every first and third Thursdays from 5 to 6, we have QTs of color, which is for queer and trans people of color from all ages 13 through to 25.
Right. So I believe this is going to be changing. The schedule is going to be adjusted in June. Yes. So the best thing to do would be to follow us on socials and stay up to date on our calendar to monitor how things might be changing over the summer.
Yes. If you go to our website at acrhealth.org, there is a referral form. So kind of walks you through the whole referral process. You'll put it there and then you can email it or fax it to Stephen. We just ask you get a little information first and then good to go.
Yeah. So that's pretty much everything that we do at the Q. And I know we got 6 minutes left. We can maybe open up for questions.
Yeah, so if you guys want to stop screen sharing.
There we go. I'm like, I'm trying to figure out how to do that. All right, there we go.
All right, wonderful. And I'll add myself in here too. All right, so I'd love for anyone that has any questions to please go ahead and shoot those in the chat so that we can give those to Talia and Ashley. But I also just wanted to, while we wait for those to come in, to thank you so much for your time and for all of this information. It's really, I found it really helpful to kind of hear all of the information presented so clearly in one place, right? And also to kind of like think through, or to hear like, oh, these are stressors, or oh, this can have an impact on my life, right? You know, I mean, as a person that's like had a lot of stress in my life, it's like a little stressful to think about it, right? So I guess, I just wanted to ask in terms of, do you have like, do these same kinds of practices work for people that maybe have accumulated stress?
Yes, I think it's really more about just kind of figuring out what works for you, right? So they take some like introspection, maybe some retrospection. So yeah, so it's kind of like, oh no, like I don't want to think about stress. That's stressful, right? But really just trying to be in touch with what you feel and how can you modify that, So it looks different for everyone, but the more that you do it, the more you're going to rewire your brain. And that's the amazing thing, is like the brain is such a fascinating thing. We're constantly firing, we're constantly building new connections. I don't know if folks have ever seen that movie, What the Bleep Do We Know? But I thought that was really like, changed a lot of the way that I looked and felt about stress, because they kind of give you like a comical look at what might be actually going on in your body. But looking at how your brain can rewire itself, it has the ability to make new connections. So the more you're doing things that feel good, or the more you're doing things that make you happy, you start to build up that resilience. So it takes time. It's not easy, but it's figuring out what makes you feel good and finding a way to do more of it is essentially how you can create healthier living.
Thanks so much, Talia. I wanted to also ask another question just around the work that you do with youth. So, we saw a lot of slides and a lot of data about how youth can really suffer, right? Especially LGBTQ youth plus youth from all of these different stressors, and also just like living in this culture, right? So I was curious if you could speak a little bit to like what the experience of like some of those youth might be when they work through the Q Center. Like, what does their engagement tend to be like when they come to group? Like, what kind of feedback do they give in terms of the impact that it's made?
Mm-hmm. Well, I know from my experience, I've been there for about 4 years now. It can be really different for everyone, of course, because everyone's different and they're coming from a different background. So we have to kind of take into consideration, like what their, traditional beliefs are, what their family beliefs are, where they're coming from. Like, these are things that we want to know about. We want to know about, what their experiences are. Typically they'll come into the space maybe a little anxious, a little bit, hesitant to share and build relationships, a little anxiety of being in a new space. But for most folks, we see them, making connections and engaging. Sometimes it's as simple as having a conversation of like, what do you like? Sometimes we do jar of conversation. So I like to do, we have a day every month where we do something artistic or creative. And that's something that I facilitate. And so, we'll just have general discussion to try to learn more about one another, and just kind of taking the structure away and making it less pressure and just kind of a little bit more of a relaxed atmosphere. Like, I've seen a lot of young people just really open up and talk about things that they love. And then they start to realize like, oh, somebody else loves that too. So it's just kind of like trying to find a way to create a forum for them. And the more that they, see that or hear that from their peers, they start to kind of warm up and join in a little bit more. So it's definitely been challenging with us being virtual. The engagement that we've seen is definitely different. I think that we have a lot more in terms of people who are coming from rural settings that maybe wouldn't necessarily have been able to get transportation to us in person. So now we're trying to like figure out how to re-engage all the folks that we used to see face to face. But definitely there was a difference in terms of, being in a room with one another and then looking at each other on a screen. So we've had to kind of work through some challenges, but it seems as though, we just have to check in with them and then like try to encourage them to kind of take the reins, because we don't want to drive the programming. We want the youth to step up and tell us what they want. So as much as we can, we try to focus on creating an atmosphere where they can do that.
That sounds wonderful, and it sounds like it's a meaningful experience for them to like have agency over their path, right? In terms of their engagement. I'll send out one more invitation to folks to please send your questions through the chat. If things come up with you later, if you're still processing, you can always email me at virtual@ymcacny.org, and I'm happy to connect you to either Talia or Ashley or both of them. They are also very easy and wonderful to get a hold of through the ACR Health website. So please do make use of those resources. When I was scheduling our program coming up in June, it was a very easy, wonderful process. And I know that you guys really just want to kind of get that information out there because of the impact that it can make on people's lives. Mm-hmm. So, yeah. Did you want to say something?
Oh, I was just thinking, this is a presentation that we've done for our youth. It was a mixed, 13 to 25 day, but, sometimes we have, presenters from other community-based organizations come in. We have like experts in different types of things like movement, meditation. And then we have lots of groups where we do fun stuff like games, and then we do some more relaxed stuff. So it's really a socially supportive environment, and it's changing what we do on a regular basis. We want to offer education and support. and then also opportunities for them to grow and, tell us what they want. So it's different all the time. So just, I guess my closing words would say, definitely find us on social media, follow us, and keep eyes on the calendar. And if you have any questions on what's happening, there's lots of different ways to reach out to us.
All right. Thank you so much. We've got gratitude flowing in the chat. Really appreciating all the information and your time. So yeah, I'll echo that and just say thank you so much. And I know Talia just kind of offered a closing thought. Anything else that you want to leave us with as we go into this kind of blustery evening on this hot summer day? All right. Well,
take care of you. Take care of you. That's all.
We're on a wavelength. So take care of yourselves, everybody. Just a reminder that we do have another mental health awareness speaker series next Wednesday with Chris Kosikowski from the Vera House, which will be another very informative and important conversation. And then following that, we're going to switch to Mondays for a month, where we're actually going to have a really exciting pride focused series that features local LGBTQ plus activists and organizers. So I'm very, very excited about that program. It's really a labor of love of mine, and I am really looking forward to seeing all of you there. And you will get some more information about that as a follow-up once this series concludes. So thanks so much to everyone for joining. Thank you so much, Ashley and Talia, for your expertise and your time. I hope you enjoy the rest of your evenings, and I'll see you again soon.